We're going to move into an interactive learning technique that I really like that's called a jigsaw. And a jigsaw is just a way to get everyone involved and get everyone learning something and then involved in teaching it. So the first thing is we've got you in groups of 4 at the tables. And so we've got you in these learning groups already. And what we're going to do with the jigsaw is you've each got a different colored piece of paper in front of you. And you're actually going to get to become an expert in one different technique here. Once you start to learn about your technique, we're going to have you form an expert group and pair up with people who have the same color as you to really delve in deep and think about how you can use this technique that you're going to learn about. And then finally, you're going to go back to your original group and teach everyone that's at your original group about your technique. So you're going to learn about it, you're going to think about how you can apply it, and then you're going to actually teach how you can use this technique. So a jigsaw, you can use a jigsaw, which is one technique, in a lot of ways. So for example, if I were teaching about professionalism, I might divide people up and say, you know, you're going to think about the different aspects that go into professionalism. How professional another person or group would think about how professionalism might differ based on the setting you're in. Another group might think about how professionalism varies based on the patient population that you're seeing, and then based on practitioner type. If you were doing it, say, with medical students or interns with resuscitation, one group might be the people who would think about how do I prepare or what do I do pre-arrival of the patient to the emergency department. Another group might think about, you know, what are the things that we're going to do in the first minute when the patient arrives. Another group might be tasked with thinking about what are the causes of, say, you know, cardiorespiratory arrest in a kid who's 6 months or younger. And then another group might focus on what medications do we have to have available. We're actually going to use the jigsaw to think about 4 other interactive learning techniques that you can use when you're doing lectures. And so we're going to have you guys look at pause procedures, fishbowl, thinking hats, and roundtable discussions. So we've got you divided up into groups, and when you read through your technique, which is on the side that doesn't have the picture, I want you to do is kind of think about how you could use your technique to teach your learners about, say, someone who's having pediatric respiratory distress. Okay? So you're in your groups of 4. So right now, we're just going to let you take a minute to read through your technique and think about how you could use this and become kind of an expert on your technique.